Hello, this is Elise Schuster, one of the co-founders of OkaySo, and I'm excited to share just a little bit with you about what OkaySo is and the programs that we have. We were started by myself and my co-founder Francisco. We met at Columbia's Mailman School of Public Health and have backgrounds in public health and youth development, as well as a lot of training and facilitation expertise and some sexuality education, sort of health and wellness expertise. And we started OkaySo as a free mobile app, which I'll share a little bit more about in a minute. We've been doing that for several years now and have answered thousands and thousands of questions from young people across all 50 states. We've really seen a lot of different kind of types of topics and issues that young people have questions about. And we've tried to really create a space where young people can feel safe, where they feel really cared for, and where they're able to share things that they maybe wouldn't feel comfortable sharing in other spaces. And some of our experiences with this app are really what led us to start some of the training work that we're doing that I want to share with you. So I'll start with the training program and then I'll share just a little bit about the app as well. Our training program is essentially on-demand trainings, and what we want to do is help adults who are working with young people kind of build bridges to them and help them get connected to further support if they need it. We offer online trainings to organizations and companies that we partner with. All of the trainings are 45 minutes or less because we know that people are extremely busy. And those trainings cover a wide range of topics, including critical skills for working with young people, or really maybe anyone, including things like empathy and active listening, trauma-informed best practices and adolescent development. And then we also have more specific topics like LGBTQ issues and setting boundaries with young people, abusive relationships and consent, things that maybe are not going to be coming up every single day, but that when they do come up, often feel quite overwhelming for staff who are trying to figure out how to handle them. We also add new trainings every couple of months, and we add those based on what we're hearing from our partners. So we try to be really responsive to folks' needs and kind of figure out what might be useful for them. And these trainings are not geared towards turning someone into an expert in these things, but are really focused on giving them the basic skills that they need to provide support in that moment and then provide a connection to more in-depth care or resources. We host all of our trainings on a learning management system, which gives us lots of great features and best practices that you would expect from an online training. And generally what we're doing with folks is a combination of things that they're reading, things that they're watching, including us presenting, as well as questions and opportunities to reflect and apply their work. We also do quiz questions and try to assess for knowledge and attitude shifts and all of those good things. Each training also has a certificate at the end, which an employee can send to their manager to let them know that they completed it. Additionally, for our partners, we offer a couple of other things. So we offer curated resources. So this is also on the website that they get when they are an OkaySo partner. And these resources really are designed for the types of youth workers or anyone working with young people that we most commonly work with. So we're not giving them a really long in-depth report. We're giving them a one-page summary of something or 5 tips for doing XYZ. So we're really trying to think about what is the most useful information for this particular population to be using. And then lastly, we also have office hours once a month where anyone who is taking the trainings can hop on. They can ask questions about young people that they're working with, or they can ask questions about the training themselves. It's optional, but essentially a bit of a personalized coaching opportunity for folks. So that is our online training work that we're doing. We also have our mobile app, which I mentioned before. So on this free mobile app, which is available for any smartphone, young people can create a confidential account And when they're asking questions, they're actually completely anonymous. So all we see is this emoji avatar that they've picked and a username. They then can see teams of experts, and the experts are grouped into topic areas. The topic areas are very broad on purpose, and when a young person selects the topic area that they would like, they then are able to ask a question in their own words, as much or as little as they want to, and then they will get a response from someone in that team of experts. Often what we see is that multiple experts can respond and jump in. So it's sort of like a group chat. It's not a private chat, and it's not something where a young person is going to be potentially like stuck with someone that they don't want to talk to. We're able to really kind of connect them to multiple people. We're also doing this all asynchronously. So we are not a live chat hotline. We actually are responding within a few hours. Then young people are getting back to us when they are ready, and then we get back to them, etc. And what this really unlocks for us is the ability to follow along with young people as they're navigating situations. We built OkaySo, the app, using something called human-centered design. And so we had hundreds of interviews with young people and did lots and lots of testing as we built this. And one of the things that we commonly heard was that when young people reached out to hotlines, like a sort of crisis text line or Trevor Project, something like that, they appreciated that time, but if they had something more that they wanted to talk about, they basically had to start all over from scratch. They never got to come back to someone who had already heard their story. So we knew that that was really important for young people, which is why we built OkaySo this way. So this also allows us to follow up with young people to see if they got what they needed, and we track our impact this way as well. You're probably wondering who our experts are. That's a really common question. They are all real people. We're not AI or chatbots, and all of our experts are coming to us already trained in their areas of expertise. So we're not taking kind of random folks off the street who want to be helpful. We are taking professionals in the field. And we have a wide variety of folks, including mostly public health experts, but social work students and peer health educators, PhD epidemiologists, etc. And we're grouping those folks into these topic area teams based on their areas of expertise. We have a staff at OkaySo who oversee all of these experts. And because of our team model, there's never an expert chatting with a young person alone. It's always happening within that group chat format. So that is a little bit of an overview of the two pieces of our work at OkaySo. If you have any questions at all, please feel free to reach out to me. My email is Elise, E-L-I-S-E, at okayso.org. And OkaySo is OKAYSO. You can see it here. Would love to be in touch. Thank you so much.